Are you, as a clinician, comfortable being an agent of rationing for your patient's health care? You are, you know, an agent of rationing, whether you like it or not. For a variety of reasons, others have made unsustainable obligations to pay for your patient's health care. They try to leverage the hard-won trust you've built with your patients to limit their own financial liabilities. They appeal to your own personal call to service and use it against you, forcing you to take the heat and spend your time to execute their cost-cutting decisions and not pay you an extra dime for the effort. Look out the window. What do you see? An avalanche of chronically ill people, both elderly and young, coming directly your way. Millions of patients who will live increasingly longer but more infirm lives, swamping a healthcare system that's made far too many promises that it can't keep. Clinicians and administrators everywhere are overwhelmed trying to meet this challenge. Is it any wonder providers are leaving in droves? But in these dire circumstances, there is opportunity. Opportunity in realizing that if you're going to have to be the agent of healthcare rationing, you might as well get paid for it. But how can that be? How can that be done without driving the cost of healthcare further into orbit? The answer lies in value-based care. Now, when I say value-based care, I don't mean treating populations to meet certain extrinsic measures that may or may not generate value to the individual patient. That's metric-based care. And we both know for individual patients, it's useless. Value-based care is care that generates value for the patient on an individual basis. The patient, not the clinician, not the administrator, not the payer, the patient. And this is how it works. So you put the patient at risk for some of their own personal health care expenses. Then you calculate the amount the payer is willing to fund for that individual patient's health care over a given period of time. Then you have the actuaries adjust that amount for the patient's own disease burden. And finally, you take that fixed amount of money and you put the best suited person at risk for any loss or gain. Now, who is that person? Well, it's not the patient. True, it is their own health, and they can Google whatever information that they need, but they lack the experience, wisdom, and emotional detachment to make the best decisions in their own interests. Well, it's certainly not the payers like the government. They have only a financial relationship with the patient, and in fact, would be best off if the patient simply died. The burgeoning euthanasia movement is certainly driven by this unfortunate fact. It's not an administrator or the organizations they work for. Their education is directed towards system development and execution. They're trained to define success in terms of return on capital rather than on the care of each individual patient. They certainly have a role in sustaining the ancillary systems that support healthcare delivery and be compensated fairly for it. But being financially at risk for your health outcomes, those incentives are definitely not aligned. No, by temperament and training, the person best suited to take the financial risk is the patient's own personal clinician. With a panel of 300 to 500 patients to smooth out the bump, and some stop-loss reinsurance to guard against worries of financial catastrophe, such a clinician can generate an equitable return on their personal investment in their own education while limiting the financial liability of their payer. It's that simple. If someone other than the patient is going to pay for the cost of their health care, then that person had better be somebody selected for empathy and trained for excellence so that they will put the interests of the individual patient first. That's not an administrator or their organization. It's not the payer, and it's certainly not the government. Only a trained personal clinician with a close, ongoing relationship with their patient will have the aligned incentives to generate true value in the exchange of money for services. That's the definition of value-based care. I stumbled on this truth long ago and spent the past 25 years working to perfect it. And now I am driven to share my knowledge and experience with you. Contact me today, and together we'll explore how you can unleash the power of value-based care for your patients, your organizations, and yourself.